The myth of inevitable decline. I want you to picture a simple morning. The light slips through the blinds. A coffee maker hums in the kitchen. You stretch and you notice something you have not felt in a while. A firm, unapologetic morning erection. The kind that used to arrive without an invitation. It is not a memory. It is your body saying, I am still here. Now shift scenes. It is a quiet Friday night. 2 mugs sit on the nightstand. You and your partner linger a little longer. The conversation turns warmer, and your body responds with strength and steadiness. No rush, no panic, just presence. Many men over 50 tell me this is exactly what they want back. Reliable erections, enough stamina to stay in the moment, and the confidence that rises when their body cooperates. The cultural story says decline is automatic and irreversible. The clinical truth says it is not that simple. I have treated thousands of men, and I can tell you that a surprising number continue to perform like they did decades earlier. They are not lucky unicorns. They are consistent. So what are they doing differently? Is there a blueprint you can follow without turning your life upside down? Today I will show you 4 natural secrets that men over 50 use to keep youthful erections. They are not magic, and they do not replace medical care. They are habits that serve your blood vessels, your hormones, your sleep, and your mind. And yes, they can serve you starting tonight. In the next section, let me show you the biology that makes these habits work. Why some men stay strong after 50. Erections are a blood vessel story before they are anything else. Inside every healthy artery is a thin lining called the endothelium. When it is happy, it releases nitric oxide, a natural signal that tells blood vessels to relax. Relaxed vessels deliver more blood to the penis, which causes the tissue to fill and stay firm. After 50, that endothelial lining faces more pressure. Higher blood sugars, elevated blood pressure, cholesterol imbalances, and low-grade inflammation nibble at its performance day after day. If you add long hours of sitting, poor sleep, and stress, nitric oxide falls and the erection suffers. Hormones matter too. Testosterone declines gradually with age, but lifestyle can push it down faster or help it remain in a healthy, functional range. Sleep is a hidden amplifier. During deep and rapid eye movement sleep, the body cycles through nighttime erections, a kind of maintenance program that keeps the tissue oxygenated and responsive. Men with disrupted sleep or untreated sleep apnea often notice fading morning erections long before they connect the dots. Medications can help or hurt. Some blood pressure medicines and certain antidepressants can blunt desire or erection quality, while others have neutral effects. Anxiety about performance can tighten muscles and narrow blood vessels at exactly the wrong moment. The men who stay strong into their 50s and 60s do a handful of things well. They protect their endothelium. They support nitric oxide. They move regularly. They sleep like it is a prescription. And they manage stress at the speed of breath. In the next section, I will reveal 4 natural secrets that tie these systems together and give you a practical path forward. The reveal. 4 natural secrets. Here is the good news. You do not need 20 steps, exotic powders, or a new personality. You need 4 high-yield habits that work together. First, you need a simple movement plan that improves blood flow and insulin sensitivity while lowering inflammation. Second, you need pelvic floor training and a few erection-friendly habits that steal back blood flow you are unintentionally losing. Third, you need food choices and, when appropriate, gentle support from nutrients that feed nitric oxide production. Fourth, you need the kind of sleep that restores hormones and restores nighttime erections, and the wisdom to screen for sleep apnea if the signs are there. These are not alternatives to prescription options like phosphodiesterase type 5 inhibitors. Think of them as levers that make your body more responsive, whether you take medication or not. When men follow these strategies, I often see measurable gains on the International Index of Erectile Function, short form, improved erection hardness scores, better penile blood flow on ultrasound, and, most importantly, a return of confidence that spills over into every part of life. This is not about perfection. It is about a few consistent, well-chosen moves. In part 4, I will walk you through each secret in detail: what it is, how it works, the kind of evidence we have, a patient story from my clinic, and exactly how to apply it safely in your own routine. Let us start with movement, because it is the most generous medicine I know. Secret number 1, aerobic plus resistance training and weight management. What it is, this is a 2-part movement prescription with one goal: make your blood vessels generous again. The aerobic piece can be brisk walking, cycling on a low hill, or swimming at a conversational pace. The resistance piece uses your muscles as a pump: body weight squats to a chair, push-ups against a countertop, rows with a band, and light dumbbells if you have them. The weight management piece is not a crash diet. It is a gentle tilt toward an active day and slightly fewer calories from ultra-processed foods, so that your waist trims and your hormones breathe. How it works for erections. When you move rhythmically, the inner lining of your arteries experiences healthy shear stress. That stress triggers nitric oxide release, which improves vessel relaxation. Movement lowers blood pressure, improves insulin sensitivity, and reduces inflammatory signals that stiffen arteries. Resistance training builds and preserves lean muscle, which acts like a glucose sponge and stabilizes blood sugar. A trimmed waist is not vanity. Visceral fat produces inflammatory messengers that harm the endothelium and lower testosterone. When your metabolism quiets, blood flow to the penis increases and erection quality follows. Evidence in friendly language. In clinical studies, men who followed a modest aerobic plan 4 to 5 days per week, combined with 2 short resistance sessions, experienced measurable improvements in erectile function within 8 to 12 weeks. A typical pattern looks like this: an average increase of 3 to 5 points on the IIEF5, a 1-step rise in the Erection Hardness Score for many men, and better treadmill endurance that translates into real-life stamina. Men with central obesity who lost 5 to 10% of body weight often saw the biggest gains. The gains are not magic. They are blood flow. Patient story: Mr. James, 67. James is a retired electrician who missed his morning erections and felt winded during intimacy. He started with 15 minutes of brisk walking after breakfast and 10 minutes after dinner, 6 days per week. Twice a week, he did a 15-minute resistance circuit at home: chair squats, countertop push-ups, band rows, and a farmer's carry with grocery bags. He did not count calories. He swapped a nightly bag of chips for Greek yogurt and berries and added a salad to lunch. At 10 weeks, James had dropped 8 pounds and 2 inches from his belt. His IIEF5 rose by 5 points. His erection hardness score moved from 2 to 3, and his morning erections returned 3 to 4 days per week. His words: "I am back in the game, and I am not out of breath." How to apply frequency and time. Aim for 150 to 180 minutes per week of gentle aerobic work. Think 20 to 30 minutes most days. If you can hold a conversation with a little breathlessness, the pace is right. Resistance twice weekly, 10 to 20 minutes. Choose 4 movements: a squat or sit to stand, a push, a pull, and a loaded carry or deadlift with a light kettlebell. 1 to 3 sets of 8 to 12 smooth repetitions. Progression: every 2 weeks, add 2 to 5 minutes to a walking session or 1 set to 1 movement. Small steps keep joints happy. Safety: if you have chest pain, uncontrolled blood pressure, recent surgery, or severe joint pain, clear your plan with your clinician. If you take beta blockers, your heart rate may not reflect effort. Use the talk test instead. Integration with medication. Movement pairs well with prescription options. It often reduces the dose needed by improving responsiveness. Start with a walk after this video. In the next secret, we will talk about the muscles you cannot see but can definitely train. Secret number 2, pelvic floor training and erection-friendly habits. What it is, pelvic floor training targets the sling of muscles that wrap around the base of the penis and support the urethra. When these muscles are weak or uncoordinated, blood escapes the penis too early and the erection fades. When they are strong and well-timed, they act like gentle dermal valve. Erection-friendly habits include a vascular warm-up, smart posture breaks, and mindful breathing that lowers performance anxiety. The plan is simple: learn the correct muscle contraction, build endurance, and integrate a few small habits that keep blood where you want it. How it works for erections. A well-coordinated pelvic floor improves venous occlusion, which is the body's natural way of trapping blood in the erectile tissue. Training also improves urinary control and reduces dribbling, which often echoes better pelvic coordination in bed. The posture and warm-up pieces matter more than most men realize. Long sitting compresses pelvic blood flow. 2 minutes of gentle movement, hip opening, and deep diaphragmatic breathing before intimacy can increase temperature, relax anxiety, tight muscles, and nudge nitric oxide upward. Slow exhalation lengthens the vagus nerve's influence and calms the body. Evidence in friendly language. Clinical programs that combine correctly taught pelvic floor exercises with brief lifestyle coaching have shown meaningful improvements in erectile function within 8 to 12 weeks. In several trials, average IWF-5 scores rose by 3 to 5 points, and erection hardness scores improved for a large portion of participants. Men also reported better control during arousal and less leakage during the day. The key is technique and consistency, not heroic effort. Patient story, Mr. Miguel, 64. Miguel is a high school coach who developed performance anxiety after a stressful year. He noticed his erection would fade at the moment he needed it most. We taught him a clear contraction cue. Lift and shorten as if stopping whilst without squeezing the buttocks. He started with 5-second gentle holds. 5 times, 3 sessions per day, with relaxed 10-second breaths between holds. He added 2 posture breaks every hour at work and a 2-minute warm-up before intimacy. Cat-camel, hip circles, and slow nasal breathing. After 8 weeks, his IWF-5 rose by 4 points and his erection hardness score moved from 2 to 3. He told me, "I feel like I have a dial now, not a switch." How to apply find the right muscle. While urinating once, try to briefly slow the stream. That subtle lift is the muscle. Do not practice during urination as a routine. Use it only to identify the muscle. Training plan, weeks 1 to 4. 5 gentle 5-second holds, 3 times per day, with full relaxation between holds. Add 10 brief pulses at the end of each session. Progression, weeks 5 to 8. Build to 8-second holds and increase to 8 to 10 repetitions. At a functional set before intimacy, 10 quick pulses followed by 3 slow holds. Posture and warm-up. Every hour stand, open the hips, and take 6 slow breaths. Before intimacy, spend 2 minutes on gentle hip mobility and slow exhales. Breathing to steady the mind. Inhale for 4, exhale for 6. Continue for 2 minutes. Safety and integration. If you have chronic pelvic pain or significant urinary symptoms, ask for a referral to a pelvic floor physical therapist. Training pairs well with medications and with movement from Secret 1. Before we dive into Secret 3, if this is speaking to you, hit like and subscribe. I have a free 1-page Erection-Friendly Habits checklist linked below. Print it and keep it on your nightstand. Drop a question in the comments and I will answer as many as I can. Secret number 3, nitrate-rich foods and L-citrulline/L-arginine. What it is, this secret lives on your plate and for some men in a simple supplement. Nitrate-rich foods like beets, arugula, spinach, romaine, and Swiss chard convert in your body to nitric oxide. L-citrulline and L-arginine are amino acids that support the same pathway from another angle. You do not need culinary gymnastics. You need daily exposure. A salad with a peppery green, a glass of diluted beetroot juice, and a habit of putting leafy greens on your sandwich the way you put tires on a car. How it works for erections. Nitric oxide tells arteries to relax. Dietary nitrate moves through your saliva and gut bacteria to form nitric oxide even when your endothelium is a little sluggish. Citrulline converts to arginine in the kidneys and raises arginine levels more smoothly than arginine itself for many people. Arginine is the direct building block for nitric oxide in the endothelium. When you support both food and amino acid pathways, you often see a practical increase in erection quality, particularly in men with mild to moderate symptoms. Evidence in friendly language. In clinical studies, men who consume nitrate-rich vegetables or beetroot juice daily saw improvements in markers of blood vessel function within a few weeks. Trials of L-citrulline and L-arginine in mild erectile dysfunction have shown average increases of 3 to 6 points on the IEF-5 after 8 to 12 weeks, with a meaningful number of men reporting a one-step improvement in the Erection Hardness Score and fewer failed attempts. Flow-mediated dilation, a simple measure of endothelial performance in the arm, tends to rise in parallel, which tells us the system is responding, not just the symptom. Patient story, Mr. Robert, 72. Robert is a retired postal worker with high blood pressure and cholesterol controlled on medication. He wanted a natural assist without disrupting his heart regimen. With approval from his cardiologist, he added a lunch salad built around arugula or spinach, 5 days per week, a half glass of beetroot juice diluted with water before dinner, and 1,500 milligrams of L-citrulline in the morning and at night. He kept walking 30 minutes most days. At 12 weeks, his IEF-5 rose by 4 points. His Erection Hardness Score moved from 2 to 3, and his wife told him, "You feel present again." He felt steady rather than explosive, which is exactly what he wanted. How to apply daily food rhythm. 1 big handful of a nitrate-rich green at lunch or dinner. Add tomatoes, olive oil, and a sprinkle of nuts for flavor and satisfaction. Beetroot approach. Start with 150 to 250 milliliters of diluted beetroot juice once per day or every other day. If you have kidney stones or oxalate issues, consider focusing on greens instead and discuss with your clinician. Citrulline or arginine. Many men tolerate L-citrulline well at 1,500 to 3,000 milligrams per day, divided morning and evening. Some prefer L-arginine at 2,000 to 3,000 milligrams per day, divided. Timing. Food nitrates can be helpful 2 to 3 hours before intimacy. Citrulline works as a daily foundation rather than a quick trigger. Safety and interactions. If you take blood pressure medicines, these strategies can lower pressure further. Monitor carefully and discuss with your clinician. Never combine any erection medication with prescription nitrates used for chest pain. Be cautious with high-dose arginine if you have a history of cold sores. If you take anticoagulants, keep your clinician informed about concentrated polyphenol supplements and stick to food-first approaches. When your plate and your endothelium become partners, your results often feel natural, not forced. Now let us talk about the place where many erections are rescued, your pillow. Secret number 4, sleep optimization and sleep apnea screening. What it is, sleep is not passive. It is an overnight renovation project. During deep and rapid eye movement sleep, the body rehearses erections, restores hormones, and resets stress circuits. Sleep optimization means a regular sleep window, a calm pre-bed routine, a cool dark room, and respect for morning light. Screening for sleep apnea means asking 3 questions. Do you snore loudly? Do you feel excessively sleepy during the day? Has anyone noticed you stop breathing at night? If yes, a sleep evaluation can change your life. How it works for erections. Men with fragmented sleep have fewer and weaker nighttime erections and produce less testosterone. Sleep apnea bathes the body in intermittent oxygen dips and stress hormones that stiffen arteries and sabotage nitric oxide. Treatment of apnea, whether with a continuous positive airway pressure device, an oral appliance, or weight loss, often improves daytime energy, mood, blood pressure, and yes, erection quality. Even men without apnea who establish a regular sleep rhythm and protect the hour before bed from screens and late heavy meals often notice the quiet return of morning erections. Evidence in friendly language clinics that measure erectile function before and after sleep apnea treatment routinely find improvements in IEF-5 scores and erection hardness scores after 8 to 12 weeks of consistent therapy. Men who clean up their sleep hygiene, even without apnea, report better libido, steadier mood, and fewer false starts. In some studies, testosterone levels rise modestly when sleep lengthens and deepens, which may support desire as well as performance. Patient story, Mr. Miguel, 64. Miguel, whom you met earlier, also snored and often napped at his desk. His wife noticed he would hold his breath and then gasp. He completed a home sleep study that confirmed moderate sleep apnea. He chose a modern quiet device and committed to it for 90 days while continuing his pelvic floor routine from Secret 2. At 12 weeks, his daytime energy returned, his blood pressure improved, his IIEF-5 rose by 5 points, and his erection hardness score ticked up again. The best part, he said, was the revival of effortless morning erections 3 to 4 days per week. How to apply sleep window. Choose a consistent 7 to 8.5 hour window to most nights. If you wake early, still get up and catch the same morning light to anchor your rhythm. Pre-bed routine. 60 minutes before bed, dim lights, reduce screens, and do something predictable. A warm shower, light stretching, or reading. Room environment. Cool, dark, and quiet. Consider blackout curtains and a small fan. Evening food and alcohol. Finish larger meals 2 to 3 hours before bed. Limit alcohol. It fragments sleep and blunts erections. Apnea screening. If you snore loudly, wake with a dry mouth or headache, or feel excessively sleepy, ask for a sleep evaluation. Treating apnea is not a cosmetic choice. It is vascular medicine. Safety and integration. If you add a sleep medication or a supplement like magnesium, inform your clinician, especially if you take other sedatives or have lung disease. Sleep pairs beautifully with movement, pelvic training, and food strategies. Together they form a loop. You sleep better, you move more, you choose better food, and your confidence returns. When men stack all 4 secrets, they often describe the same outcome. Not only stronger erections, but a steadier sense of self. That is the real prize. In the final section, I will show you how to begin tonight and what red flags deserve a doctor's visit. Your next step. Here is the blueprint many men over 50 follow to keep youthful erections. Move most days with a little strength work. Train the pelvic floor and your breath. Feed nitric oxide with greens and a simple supplement if appropriate, and guard your sleep like you guard your home. None of this is glamorous. All of it is powerful. Pick one action for tonight. A 10-minute walk after dinner. A 2-minute pelvic warm-up before intimacy. A handful of arugula on your plate. Lights dimmed and phone outside the bedroom. The body notices small, repeated kindness. If you found one idea helpful, please tap like and subscribe, and tell me in the comments which habit you will start tonight. Your story may be the reason another man sleeps well and wakes up with confidence. If you experience chest pain with exertion, painful prolonged erections, a sudden drop in desire with fatigue and weight loss, a new onset of erectile dysfunction out of the blue, or if you have heart disease that is not well controlled, schedule an appointment with your clinician. Help is real. Partnership works. In the video description, you will find a free 1-page Erection-Friendly habits checklist and links to related videos on heart metabolic health and sexual function. In the meantime, take the smallest next step. Your future self will thank you.